Hello, everyone, and welcome. I'm Mychael Schnell, Congressional reporter at The Hill. Thank you all for joining us today for a deep dive into The Hill Talks breaking down financial barriers to clinical trial participation. I'd like to thank our sponsor, Eli Lilly, for their support of this discussion. Now, most of us are familiar with the concept of clinical trials, may even have a family member or a friend who's taken part in one. These studies are important for researching potential new cures and treatments for diseases, and many provide participants with earlier access to potential new medicines. However, there are large segments of the U.S. population, particularly those in rural areas or with limited incomes, who have been excluded from clinical trials. For these patients, the financial burden of participation may simply be too high, with lost wages, time, and out-of-pocket costs for transportation and lodging. So what can Congress do to make clinical trials more accessible to patients? What are the biggest barriers to participation? And what does this all mean for the future of drug development? Today, we'll examine these questions and more. Now, before we get underway, a few housekeeping notes. Please join the conversation on social media. You can find us on Facebook, X, and Instagram at The Hill Events using the hashtag TheHillHealth. And my first guest is Dr. Larry Bucshon. He's a senior policy advisor at Holland and Knight and a former congressman from Indiana. He's advocated for patient-centered healthcare reforms that support innovation and give patients access to high-quality, affordable, and timely care, while also ensuring that patients and their doctors have the freedom to make their own healthcare decisions. Dr. Bucshon, thank you so much for joining us. Let's start here. You have been focusing on this issue while you're in Congress, also with your background as a physician. What changes in your eyes need to be made to help improve clinical trial participation among some underrepresented communities?
Well, there's a number of them, and as you probably know, in the last Congress, Dr. Ruiz and I had H.R. 8412, which would modernize clinical trials for a variety of reasons. There's financial barriers involved, transportation to and from, housing, and other things that limits participation. Some of the other things are just physical location. You have people in rural communities that don't have access to academic medical centers, so they can't participate. So you need to consider things like remote participation. And, a lot of underrepresented groups haven't historically been just recruited, right, for these programs. And most of it has ended up having populations in clinical trials that don't represent what America looks like today. So, there's a lot of things going on here, but one of the main issue, I think, is financial support for participants. They just can't afford to participate in a clinical trial for a variety of reasons.
Yeah, this is something I wanted to dive into, and we're going to get to it from a lot of different aspects. But I was so taken aback by the statistic that I learned that there are only 5% of the population participates in these clinical trials. What do you think is leading and result? Why is that number so low? What is leading to that number being such a staggeringly low number of just 5%?
Well, for some, they just don't realize that these things are out there. A lot of people will participate. For example, if they get cancer and they realize that they are at the end of their line as far as traditional treatment, and they start looking for clinical trial availability. But prior to that, they're just not aware that these things are out there. And I don't think overall, we've done a good job recruiting diverse populations of people over the years. And then honestly, there are populations sometimes that just feel like, they don't want to be a quote unquote guinea pig, right? They don't have confidence in the system, so they won't participate even if you ask them. So there's just a multitude of reasons. I think a lot of it, though, like I said, comes back to financial incentives and financial barriers. But a lot of it has to do with the fact people just aren't aware these things are out there unless, like I said, unless they have a medical condition, and then they start looking around.
Are any patients penalized financially for participating in these trials? Do they have to put up money to participate, or is it more so that folks who are just exposed to this more and more resources are able to participate? What exactly is the financial and economic foundation of leading to this problem?
Yeah, I would say generally no, people don't have to pay to participate, but there are substantial costs. Say, for example, you live 200 miles away from an academic medical center, and a lot of financial support just isn't there for transportation, housing, and all of those things. So unless you're, like I said, unless you it's directly affecting you, like you're a cancer patient or something that needs to be involved, the financial barriers prevent people from voluntarily saying, well, I want to participate in this to see, how I can help future generations with medical issues, because they just can't afford to do it. So in general, I think it's that. It's not the fact that they actually have to necessarily pay the researchers directly to participate, but all these other outside costs are the barrier.
Sure. And then before you were in Congress, you were a physician, surgeon, full time. I guess first I'm going to
Yes.
ask: Are you still at that? Or do you still work in medicine? And then have you seen this yeah, front row, firsthand? Have you worked in any of these clinical trials and sort of seen any of these issues up close?
Yeah, no, I haven't practiced medicine since I got elected to Congress. You really can't. I was a cardiovascular and thoracic surgeon, so you can't do that even part-time. And yes, during my medical training, during residency, we had all kinds of mostly clinical trials going on, not laboratory type, but like, for example, patients came in with certain infections to our surgery department, and we had trials going on testing different effectiveness of different antibiotic therapy, for example, and we would offer patients, on site participation in these studies, and a large percentage of people, number one, weren't aware of them, and number two, were reluctant because, again, they felt like, well, I'm not wanting to be a so-called guinea pig in this study. I want my infection cured, right, or my disease cured with standard therapy. So yeah, I saw it directly. We had a difficulty, and sometimes takes months or years to get enough people into a clinical trial that the results of the trial will be statistically significant that gives you a result. So yeah, I saw it directly during my residency training when we were trying to get people involved.
And then let's sort of dive into, I think, a question a lot of folks' mind. What can Congress do about this? I know that you had some legislation that you worked on when you were in Congress. We're going to
Yes.
dive into that after. But just first, like 30,000 foot view, what capacity does Congress have to help improve these problems that we're laying out here with clinical trials?
Well, I mean, I think they'll need to allow researchers to use some of the research dollars to financially support participants in certain studies. And again, Dr. Ruiz and I had legislation last Congress. It was 8412, and your viewers can Google that and see what that did. But it did take down some financial barriers, and it added some grant money in there for specifically offsetting costs like transportation, housing, and other indirect costs for patients to participate. So I think from a federal government standpoint, that you can include grant programs that allow researchers to recruit people from rural areas, from underserved urban areas, and support them financially through federal grants. And I think that's one of the approaches. That was one of the barriers to getting the bill across the finish line, because you know that right now, as you see, the federal government budget is very tight, and things are actually being cut rather than added. But I think that's where Congress could go, grants to support these type of costs for people to participate.
And then let's dive into the Clinical Trial Modernization Act. I know that you co-led that, as you mentioned, with Congressman Ruiz.
Yeah.
Explain to me, what exactly would this bill do? What are sort of the key tenets of it?
Well, it did a number of things that I've talked about. It helped remove economic barriers by creating grant programs, but it also allowed, in some instances, for participation remotely in clinical trials. It depends on what the trial is, right? If you're doing a clinical trial based on, um, psychiatric issues or things, you can do those remotely. And, it also used some of the grant money to help public relations to help recruit people from underserved populations, like, our inner city populations, our rural Americans that may or may not be aware that there's studies available out there. And so, also it wanted to make sure that, say, for example, you get a grant and you're supported financially for your travel and your um, housing, that you didn't get taxed on that wasn't considered taxable income. So you have to look at that on the back end also. So it did all of those things, but primarily create grants to help offset financial costs, but then also potentially create a system where people can participate remotely in clinical trials.
The bill was introduced in the last Congress. It didn't get a vote, despite it having this bipartisan backing. Are there plans for Congressman Ruiz or somebody else to reintroduce it this Congress? Do you know? And do you think it has a chance of potentially getting a vote on the House or in the Senate, and progressing to maybe one day make it on the president's desk?
Yeah, I think they are going to reintroduce it. I've heard recently that we're there, Dr. Ruiz is gonna have a Republican co-sponsor of this legislation. One of the barriers also, and I didn't mention to this, was of course the whole situation, honestly, surrounding DEI and whether or not, this constituted another form of that, which in healthcare it does not. It kind of got confounded in there. We actually changed the name of this legislation from diversification of clinical trials to modernization for that reason. So I think, some of that narrative is softening and people are realizing, look, in medicine, having diverse populations participate in clinical trials is critical because, certain groups of people will go, well, yeah, I mean, I can take that medicine, but the clinical trial didn't have anybody, didn't have any women in the study or something, or didn't have any African American people in the study. And people will be reluctant to accept those results for themselves personally, right? So I think there's a lot of opportunity for this to ultimately make it into law because it just makes common sense, right? We do have to get back past the budgetary issue with a grant program, and I can't recall exactly what it was. I think it was like maybe $20 million over 10 years. It was a small amount of money, but we have to get past that. But I'm optimistic because people more and more are realizing how important this is. When you had the vaccine trials, for example, for COVID, some of the resistance in rural America and amongst African Americans was the fact that they didn't have confidence in the clinical trials and whether or not it was safe to take the vaccine. And there was some history there where it takes many years to get vaccines produced. They were leery about the short-term nature of producing the vaccine, even though it was, in my view, a transformational process. People just didn't have confidence in it. So, I'm hopeful. I'm really hopeful, and I think ultimately this type of thing will become law. When, I don't know.
Another aspect that we're going to be discussing a lot throughout all these conversations as part of this event is there's the economic barriers that come with these clinical trials, but also there's the diversity aspect, and I think you kind of alluded it to. And of course, it could be
Yeah.
economic diversity, but it could also be racial diversity. How is that played out into these clinical trials? Is that an aspect where these clinical trials participation could improve in terms of having a more diverse population of folks take part? And what are some of the barriers there?
Well, absolutely. That's the whole intent of what Dr. Ruiz and I were trying to do, right? Is create a population of people involved in clinical trials that looks more like the population of America, right? Because that creates confidence in the system. And when you have low participation in whatever study it is for certain groups, whether it's ethnic, racial, or whether it's men, women, children, adults, and you don't have that type of diversity, people won't have confidence in the results. Not the scientists, the citizens, and I totally understand that. So, it's critical, and a lot of the participation barriers are geographic. Like I said, people in rural America that I represented, I mean, they really couldn't go, 200 miles away and participate in these clinical trials just out of the goodness of their heart. Not that they didn't want to, but then they had these financial barriers. They have to buy gas to travel there. They have to stay in a hotel. They can't do that. And they may have to make multiple trips and take time off work. That's the other thing we didn't mention is, the time commitment in some clinical trials is substantial, and people that have to work and can't take time off. So those are the barriers. I mean, I think, researchers at large, for the most part, are trying to recruit a more diverse population of people, but there are these barriers that we've mentioned that are stymieing that effort.
Congressman, I have one more question for you. We're running out of time here. Fascinating conversation. What gives you hope right now about the improvements that could be made in the clinical trial space? And you've been away from Capitol Hill for a little bit, so perhaps you're a little bit more optimistic than some of your former colleagues who tend to have more of a pessimistic attitude when you're up on Capitol Hill, where there's a lot going on under the dome. But curious to know, what gives you hope about this current area right now of how things could improve?
Well, I think coming out of COVID, I think people realize that it's necessary, right? I mean, we saw again with COVID what happened. We in rural America, I had a bunch of people that wouldn't take the vaccine, and for a variety of reasons, and it wasn't just political. Some of them just didn't have confidence in the process because they didn't understand it. They weren't allowed. The people that were in the study weren't from rural America, and then you had other populations of people. Initially, the African American population in the cities that were reluctant because of historical studies, the Tuskegee experiments and stuff, but that the federal government did many years ago, but also the fact that the studies on the vaccine didn't include many of them because they either weren't asked to participate or they couldn't afford it. So that's why I think coming out of COVID, people now recognize the importance of this issue, whereas before COVID, maybe people did not.
All right, Dr. Larry Bucshon, former congressman from Indiana and the senior policy advisor at Holland tonight. We have to end it there, but really interesting insights. Thank you so much for taking the time to chat today. We appreciate it.
Well, my pleasure.